Welcome back. Now we'd like to introduce our keynote speaker, Dr. Isaac Yip Pui-lam. Dr. Yip graduated from the University of Hong Kong with Bachelor of Medicine, Bachelor of Surgery, and Master of Research in Medicine. He received training in psychiatry and obtained the Fellow of the Hong Kong College of Psychiatrists, the Fellow of the Hong Kong Academy of Medicine, Psychiatry, and is a registered specialist in psychiatry. He had worked as an associate consultant psychiatrist in a public hospital before commencing private practice. Dr. Yip is currently the member of the Public Awareness Committee of the Hong Kong College of Psychiatrists, the EXCO of Society for the Advancement of Bipolar Disorder, member of the Work and Employment Subcommittee of the New Life Psychiatric Rehabilitation Association, and a member of the Publication Committee of the Mental Health Association of Hong Kong. Dr. Yip, please.
Thank you very much. Good morning, everyone. And first of all, I would like to thank you, FSTE, for inviting me to give this talk on the skills of engaging and communicating with persons with suspected mental health issues. So our MC has already introduced myself. And so one thing is, if we look at this topic, so persons with suspected mental health issues. And as a psychiatrist, day in, day out, we deal with people with quite a broad range of issues. Things like, we range from like common mental health disorders, like depression, anxiety, obsessive compulsive disorders. We also handle clients with like severe mental illnesses, like psychosis, schizophrenia, bipolar affective disorder, and also people with like alcohol problems, substance abuse problems, and to the more also arising is like the attention deficit hyperactivity disorders, and in the elderly range, maybe dementia, other mood disorders. But I understand that today we are focused on post-secondary education. So in this early adulthood or late adolescence period, perhaps the more common, the more important issues that we are dealing with is people may start to have like depression, and some people may start to have bipolar affective disorder, and then also the psychosis. So today in my presentation, what I will do is I will first of all cover some general points about like interviewing and communicating with persons. And in the second part, I would also give some specific sharings on things like people who are depressed or who may start to have like features of psychosis. How do we, or people who have suicidal idea, how do we communicate and how do we engage them? So first of all, some general points about the interview is first of all about the setting. We are aware that only a very small portion, a minority of the patients are having like violent risk. But anyhow, as a standard precaution, we always pay attention to our setting. So the place, we have to make sure that the place of the interview is safe. Preferably another person knows where and when is your interview. Ensure that help can be called if needed. And important thing is, ideally, there should be no obstruction between the interviewer and the exit. As I mentioned again, the great majority of people with suspected mental health issues do not have any violent or aggressive tendency, but that is just a standard thing that happen in the interviewing skills. And also, we should remove any objects that could be used as a weapon. So if you have got some sharps, a pair of scissors on your desk, that is not a very good idea, and it's probably better to put them away. So before the interview, So we have to find out what is known about this person and why has the assessment come about. So we try to find out as much background information as possible before the interview starts. So as I mentioned that, so that is the setting that we usually do. And first of all, we greet the person and we introduce yourself. And it is very important to explain the purpose of the interview, because sometimes they sit down and then if they do not have any idea why you're here asking them questions, they would be quite anxious. And comfortable seats for the person, and ideally, so there are 3 seats in the diagram. So the professional would be usually sitting next to the desk, of course. And ideally, if there is one client, the clients would be sitting opposite. So you can see that the chairs are arranged at an angle. That is a more ideal setting rather than directly looking at each other, because it's kind of more comfortable, more relaxed, and then a less confronting kind of a sitting position. So it's better to arrange the seat in an angle, and so that you can maintain proper eye contact. And after the setting, there are actually, when we start to approach the clients, we start to ask some questions. And there are actually different styles of questioning. And what we encourage to do is we use more open questions. By open questions, we mean questions like, could you tell me about like why you're here today? Could you tell me about what is your problem? Could you tell me about like how are you recently? So the good points about open-ended questions is that you could have like you could generate more information from these open questions. But sometimes we need to use closed questions, like have you something? Like, for example, if your clients tell you that, well, it's very distressing, sometimes I thought about not wanting to live anymore. And then he paused at that point. Perhaps a good thing to do is to follow up with a closed questions, like, I can see that you are very distressed. In that case, have you sometimes thought about like wanting to harm yourself? Or do you have any plan for that? So that is closed-ended questions, but it is still useful because it helps you to supplement or to get extra information when the client did not sort of spontaneously give you that piece of information. But we should avoid using all closed-ended questions throughout the interview, so we try to use more open questions. Sometimes we need to use clarifying questions, like when your client tells you that, when I'm in the school, I think everyone is looking at me. And then he paused. So the thing to do is, so could you give me an example, like when did that happen and what happened? And what we should definitely avoid is is the leading questions. Sometimes when we're in a hurry or people who wanted to get an answer, they will ask, well, you don't want to die, do you? Then that's not a good question, because it's a leading question, and the clients, if they sense that you're leading them, they will give you the answer that you want. But that is not the answer in their heart. So that is something we should definitely avoid. And the general point about interviewing is that empathy is very important. And I think quite a lot of us have heard about empathy. Empathy is very different from a similar word called sympathy. Sympathy is like, well, I think you're in a very upsetting position, and then I sympathize with you. But that is not what our clients really need. What our clients need is empathy. Empathy is like in the diagram. Be able to put yourself in their shoes. So in Chinese, it's called 設身處地. So it's like you see there is a baby crying. The other baby actually sensed that he was upset, and so he was, doing some comforting touch on him. Empathy is very important because it helps to establish what we call a rapport, a good relationship with our clients. So how do we give empathy? Some people may very readily use the phrase, "Oh, I understand what you feel," but that may not be the best way to do. So in Chinese, they always say, 我明你嘅感覺嘅咁。But why is that not good? Because very often your clients would think, you're not me, you do not go through all these sufferings. So how do you understand me? So that is not the best way. The best way to do is to be able to point out the emotion that you observed. For example, you can tell them, I see that you are very angry with this incident. And then continue. Or when you see them crying, weeping, you can tell them, I see that you are very upset. Or you can paraphrase this, you must be very upset by this. So if you can name or you can tell the emotion that they are having, they would understand that you can empathize with the feelings. So that is better than just saying that I understand how you feel. So during the interview, what we do is we allow them to describe his or her problem spontaneously, as much as possible, without any interruption. But if they digressed too much, perhaps what we can do is we ask some gentle question to try to bring them back. And we should be very alert to the verbal cues. It's things like when they're describing their problems, like they sitting and, for example, they tell them, and my father, and then they stop. Okay, so what we do is we have to pick up this cue. We do not just let them go, but we can ask like, and I saw that I heard that you mentioned your father just now, and then you stopped. So was there something with your father, or can you tell me a bit more? So we have to be very sensitive to like the cues that they give us, and not to, disregard them or to discard them. But cues are not just verbal. Very often they are non-verbal. For example, if they talk about something, and then they started to cry, perhaps that is something that is very important for them. So we can also ask them like, well, just now when I see you talk about your boyfriend, you look very upset and you cried. So can you tell me a bit more about what's happening? So these are very often the cues, verbal and non-verbal, that we need to pick up in the interview. Sometimes our clients would get angry or they get agitated. So what happened is we need some techniques to what we call de-escalate the situation. So we can imagine that we have if someone gets very angry and then you talk even more loudly, and you wanted to control the situation, and you talk even more loudly, what happens is the other person will get even more angry. And these are what we call escalating. 升級嗰個對峙. So what we want to do is the opposite. We want to bring the situation down, not up. So first of all, we need to ensure that there is adequate personal space. If we are too close to each other, sometimes we feel a sense of threat. Okay, so we need some personal space. The other thing is we need to try to be non-threatening as much as possible. And how do we be non-threatening? First of all, you have to be calm yourself. If you are very anxious or you start to become angry, agitated, then the other person would feel that, and then they become even more angry. So, and for the eye, we need to have some eye contact because we need to see what's happening, but we should avoid staring or directly looking at them in a staring gaze, because that would be taken as a sense of confrontation. And also, the body gesture is very important. So if they start to get angry, and then you lean your body forward, and then you try to put up your hands, well, for them it's a very threatening meaning. So avoid that, and avoid any sudden bodily movements. It's very often like when they get more agitated, and then you try to bring them down, and then you have sudden movements. For them, it's something that they do not know what's happening, and that would bring them even more angry. So what you have to do is to speak slowly, gently, but clearly, and it would help to lower the voice. So because if you speak in a lower tone, in a slower manner, that would be more calming. Empathy is very important again, so you have to allow them to speak. And when they are angry or agitated, just avoid any arguments or confrontation. And also, we empathize the underlying feeling. Well, if they're very angry and they start, disrupting things, well, of course, we do not agree with the behavior, but what we do is we empathize the feeling that is underlying. So we can say something like, I can see that you are very angry. Well, is there something that is, upsetting you? How may I help you? So if they feel that you can empathize with, again, you can empathize with their feelings, that would be able to help them. And we can suggest alternative behavior. So if you see that they're very angry, you can see, how about we get a glass of water and then let's say we take a break, 5 minutes, and then we can talk and then we see how we can help you. Now, in some specific conditions, that is the part 2 of our talk, and so I've listed 3 specific situations: people who are depressed, who may have features of psychosis, and who have some suicidal ideas. So how do we communicate with them? First of all, for depression, and then I think we may have some background understanding, but just to have a short recap, it's like people who have a persistent and pervasive low mood for a period of time, like more than 2 weeks. And then when they're very depressed, they would have several features, like the mood, they could be very depressed, but they could also be anxious or irritable. For the behavior, they would be losing interest in things that they normally enjoy. They could be very tired, and then they lack energy, and then they lost the motivation, and also a lot in the cognition, in the thoughts. Like they have difficulty in concentrating. They have negative thoughts, like they would feel that they are useless. They would blame themselves for many things. They have a lot of guilt feelings and have low self-confidence and all that. They may think that they may look at things in a very pessimistic manner, like they thought that nobody is going to help them, is helpless, hopeless, etc. Of course, they may have some of them may have suicidal ideas. Of course, they sleep poor, and then the appetite is not good. So these are the features of depression. So first of all, we have to understand that depression is an illness. It is not that they're lazy or they're weak, they are useless, etc. So we need to be very careful. We do not convey any kind of meaning which they would be taken as a criticism, as the above. The other thing is that we have to have a realistic expectation for that person. For example, if they're depressed and then they could not attend the school regularly, or they have very poor sleep, they could not get up, in the morning, we have to take that into account. We do not blame them, or we do not force them to do things that they're very hard to do. And then emotional support is very important. So in people who are depressed, or actually people who have any kind of emotional or distress, the important thing is that they feel that you are there to care for them and to listen for them. So I think at this stage, listening is actually a lot more important than like you're trying to help them to say all sorts of analysis, giving them a lot of solutions, a lot of suggestions of what to do, etc. So emotional support and caring is a lot more important at this stage. So encourage the person to talk to you. Now, sometimes when they are very depressed, they may not like to talk. When you talk to them, they may not respond too much. So at this time, we may need some encouragement, and things like we could encourage with some statements of empathy, like, I can see that you are very upset, I can see that you sleep poor and that affected you a lot. Perhaps there are something that is distressing to you. Can you tell me a bit more? We can try to help you. That sort of thing maybe would help to encourage the person to talk to you and be a good listener. Now, that is very important because, as I said, when they often need listening more than you're giving them a lot of advice in the beginning. So be a listener. We should very often we are too quick in jumping into analyzing the situation, giving them solutions and giving them suggestions, and then interrupting them when they're talking. But we just avoid that, and we try to listen as much as possible. And then we also give the person the hope to recover, because people who are depressed, very often they have negative thoughts, like they feel that things are helpless, hopeless, etc. It's like they are wearing a sunglass and then they're looking at things, so everything is gray or black. So in that situation, we need to give them the hope for recovery, and we can tell them that in fact, people with like common mood problems like depression, anxiety, it's very common. Like in fact, 5 or 6 people in the lifetime would be 1 in 5 or 6 would be having some anxiety or depression problem. And actually, most of them could significantly improve when they seek help. So it's kind of give them hope for recovery. And maybe we can tell them that at this moment, it may be a little bit hard because we see things quite negatively, but in fact, when you recover, things will be quite different. So we can give them the hope that they would recover, and then encourage them to seek professional help. Now, this could be quite difficult, because very often, perhaps they do not see the hope for recovery, and also sometimes they do not see the need to see any psychologist, psychiatrist, etc. And in that case, a very common question is, how do we encourage them to seek help? Now, that varies person by person, but the main theme is that we need to find out what is most distressing and what this person cares the most. For example, one person may be very distressed by the depression because they could not sleep every night. So insomnia, sleep problem is the main concern. For the other person, if they are very concerned about their study, they may be most concerned about if the mood is not good, they cannot concentrate in the class, they could not concentrate to do the assignments, projects, and they're very concerned about it. So we need to we need to find out what is the thing that this person concerned the most. Some people may be more concerned about, if I'm depressed and then I lost interest in meeting up my friends and my family. If they're more concerned with the family relationship issues, that is the main concern. So we need to find out, it differs from person to person. And we try to use that point, the thing that they concern the most, to motivate them to seek help. For example, if they're most concerned with study, we can tell them that, okay, so in this situation, there is some help available, and that could help you, recover. And then after you recover, you would be able to regain the concentration in class, the concentration in doing the assignments. If they're most concerned about, relationship with family, then we can tell them that with improvement, you can actually connect with your family better, and then to reestablish the relationship. So it depends very much. And then also people with suicidal or self-harm, so we need to be careful, and I will talk about this later. So very often there are things to avoid, like we do not just tell them to be happy, because very often we know that they are a bit upset or depressed, and then we try to give them some response, but very often they're not accurate. We tell them, be more happy, just don't be upset. They just cannot, because they are affected by the illness. And so we do not tell them to be this, and then do not be hostile, like criticism. And on the other hand, we don't over-involve or over-protect, so like protecting them from doing anything and then thinking that they could not do it. In that case, that will affect their self-confidence even more. And then this is very important, we do not trivialize the person's experience. So very often, especially common in Cantonese, 我都唔係咁差啫，大把人差過你啦，我都試過好多啦。And then what they will do is they feel that you do not understand what they are feeling. So do not trivialize or minimize the person's suffering or distress. Do not dismiss the person's feeling. For example, someone is talking to you how upset they are, and then you suddenly tell them, you don't seem that bad, you're okay. Well, in that case, it's not a good response, because they again, when they feel that you do not understand them, they are not going to tell you about the problem anymore. So that is very important. And the other issue is common is people who have suspected features of psychosis. Things like, well, for psychosis, we know that they may be hearing voices or noises that do not exist. They may be starting to feel that everyone is looking at them, talking about them, or trying to do something to harm them, etc. So you can imagine that they're more sensitive, okay, or maybe a bit more suspicious. So in that case, we need to be particularly caring and non-judgmental. Now, a very common response to, if somebody tells you that, well, I think everyone is looking at me and then they're talking bad things about me. So one very common response is, oh, you're thinking too much. 你諗多咗啦咁. But that is a very poor response, because in that case, they definitely feel that you do not understand them. And again, they're not going to tell you anymore. So we allow them to talk, and then we need to reassure them that we are there to help them, to support them. And then, of course, if they are not willing to talk, we do not keep forcing them, but we can encourage them a little bit, but but you can tell them, let them know that you are available when they wanted to talk. And so the thing is, I've mentioned is, do not dismiss, or minimize, or argue about their experiences. Say, like, if they think that they heard voices that does not exist, if they kind of feel that everyone is persecuting him, trying to talk about him, then although it sounds unreal to you, but it's very real to them actually. So they feel it is just a real experience. So you do not argue with them. No, it doesn't exist. Nobody is talking about you. How can people monitor you? They don't know you. Don't just try to argue with them about it. And then, of course, do not laugh at them, and then allow time to them. And then what we do also in the interview we can do is we try to pick up some cues, again, verbal and non-verbal cues. And one thing that for example, this example, like in the interview, if your client suddenly they look at your watch in a rather suspicious manner, and then they talk about something about the watch, do not just stop there and then let it go. So maybe that is the cue that there is some of the thoughts is tied to the watch. So what we will do is we can explore at this point, like, I saw that you are looking at my watch and then paying attention to it. Can you tell me a bit about what you are thinking about? Perhaps it is at that point that they could start to talk about, I thought there is something that is installed, there's some chips installed in your watch to monitor me, etc. So these non-verbal cues are very important, because it helps us to understand what is underlying in their thought, what they are thinking and what they are feeling. So encourage them to seek professional help. Again, could be difficult. That could be difficult, but again, the key feature is that we try to understand how the experience affects them, and then what they are most concerned about. And then we try to use what they are most concerned to motivate them to seek help. Whether this is their sleep, if they are very upset, if they're very anxious and then they couldn't eat and then they lose some weight, maybe that is something that they're most concerned about. We could use all these to motivate them to seek help. And by the way, seeking help doesn't always mean seeing a doctor. Sometimes, of course, we see a lot of such cases, but sometimes it's like they initially they're very reluctant to see a doctor. So whatever we can motivate them to do, we can actually try. The options like we can, if they're reluctant to see a psychiatrist, we may talk if they would like to talk to a psychologist, because in some house they may think, well, it's better to talk to a 心理專家 or 心理學家 and then not a 精神科醫生. Some of them may think this way, that it doesn't matter. If that is the case, then we try, okay, what about we seek help from a psychologist and see whether we can help you manage the stress or manage the difficulties. Well, some of them, maybe if they're reluctant to see a psychiatrist, we can tell them, what about we may seek help from a family doctor, like a a family doctor may help you, perhaps because you sleep very poorly, and then a family doctor may help to maybe see if any medications can help with your sleep. So as long as something that could, start with some engagement with the service, that may be a good idea. So if they refuse to seek help, we need to evaluate whether the situation is urgent, whether we need any emergency help, maybe even to send to hospital, encourage them to talk. And sometimes if it's not that urgent, we understand that we may not, even if we think that he may need some medical help, we may not be able to, deliver that message or to get them see the doctor in the first interview. So we may need some time to build up the trust and the rapport. And sometimes with time, they would be able to follow your advice. Of course, in the case of emergency, like they have a very imminent risk of harming themselves, harming others, acting out their abnormal beliefs. That may be a case of emergency. We have to speak quietly, non-threatening manner, try to de-escalate the situation, and if something is really emergent or out of control, then call for assistance. Again, for de-escalation techniques, we have talked about just do not be challenging, do not be threatening, and then be calm. And then any threats they should be taken very seriously, like if they believe that they are being harmed by others, they may have ideas to revenge. And if they talk about these, we need to be very patient and careful in thinking, asking them to talk about their thoughts or their plans in mind. And then seek help, and if out of control, then remove yourself from the situation. And finally, the last 2 minutes, we'll talk about some people who have suicidal thoughts. Again, we should avoid some common mistakes. Some of us may argue about the thoughts of suicide. No, you don't want to die. Well, you're in a great situation. Why would you want to die? Now, that is not a good idea, because if they really have these thoughts of suicide, then arguing with them doesn't help. And again, that will make them think that you really don't understand them, and then they don't want to talk to you anymore. And then some of us will try to discuss whether suicide is right or wrong. It's wrong to suicide because the life is given by your parents and all that. Again, it doesn't help at all, because if somebody who already has idea to harm themselves, they wouldn't be changed by these rational arguments. And then some of us may try to use guilt to prevent them from suicide, telling them that you would be punished by God, or your whole family would be in guilt. Again, that is not a good way to do. Of course, again, I stress that we should not minimize the person's feelings or problems. Like, yeah, you have got a great life, your life is not that bad, why would you want to die, and all that. It, again, gives them a sense that you do not understand their problem. And that this is very common. Like sometimes when we see in Facebook, somebody is posting very upsetting remarks, people always just leave the messages like, don't worry, cheer up, tomorrow will be better, everything will be all right. Again, it doesn't sound good to the person who is suffering, because to them, these are not true. It's not that they do not want to cheer up, but it's just that they couldn't. And they obviously do not feel that everything is all right. They feel that everything is a problem. So superficial reassurances does not help the situation at all. Also, we should avoid showing lack of interest. Sometimes when people who express that they wanted to die, people may think that you're just seeking attention, or you're just saying something like that. But again, that is not true, because sometimes they may be really thinking about it seriously. And even worse is sometimes challenge them. You just jump down. Actually, quite a few days ago, one of my patients told me that the husband is a bit emotional, and then the patient just told him, you just jump down right now. Now, that is a worst comment. So sometimes people do get irritated, and then they jump down right at the spot. So do not challenge them. Do not attempt to label them with a mental illness. It's like when they're having distress and having thoughts to harm yourself, you just some people would just tell them that you're mentally ill, go and see a doctor. Well, of course, it may be possible that they're having some mental sufferings, psychiatric illness, but we do not label them, and then because that makes them a bit more upset, and then do not offer drugs or alcohol to the problem, like to the patients, like. Sometimes if they could not sleep, you just give them drinks, or these are the sleeping pills that I have, and then you just give them the sleeping pills. That is not a good idea as well. Okay, so with these, I hope I have given some overall general view about the how do we interview or we communicate with people with suspected mental health issues, and also we have some issues, specific issues on suicidal idea, depression, and psychosis, and hope it would help. Some questions?
Thank you, Dr. Yip, for sharing the useful skills of engaging and communicating with persons with suspected mental health issues. The floor is now open for Q&A section, so please feel free to send your questions through the live Q&A chat box. Our speaker, Dr. Yip, will answer selected questions. Thank you. We've received a question for Dr. Yip. The question is, I believe that teachers and counselors are driven with a kind heart to support students by talking to them. However, I'm afraid that during our conversation with students, we may unexpectedly add more emotional stress or pressure, which potentially triggers emotional breakdown or worsen the situation. Any advice or tips for us?
Okay, all right. So that's why I have emphasized that listening is actually more important, because without very in-depth listening, sometimes we just say what we wanted to say, and then that may actually even trigger the situation a bit more. But sometimes, well, if things does happen, even for us, professionals, that psychiatrists or psychologists, that we may have said something which upset the patients or our clients. If that is the case, I think we have to be sincere. In that case, what I will do is that I can see that you're a bit angry right now or upset. Perhaps is there something which I have said and have been upsetting to you? Just let me know. If that is the case, I'm really sorry for that, because what my intention is to try to help. But if you can let me know what is upsetting to you, perhaps that would help me to understand your situation a bit more, and I would be willing to adjust and all that. So in some case, you need to apologize if you really said something which agitated or irritated the client.
Thanks for the advice. The next question is, for students with suspected mental health issues who show social withdrawal, that is, avoiding social contact or refusing to receive help, how can we engage them?
So in that case, it really depends on whether social withdrawal, you mean they are simply not coming back to the school, or they're staying at home all the time. Now, if that is the case, if they're simply refusing to come back to the school, it depends on your system, but I guess perhaps it may be difficult for a teacher to do a home visit, assess the situation, etc. So in that case, I think it's back to the previous slides. If it's perhaps out of something which we can do, we need to seek further help. And in Hong Kong, there are different, actually in the hospital authority system, there are people which is called community psychiatric nurses or community psychiatric services, who could, if for really, cases which they're so withdrawn that they don't even leave their home, and they could do some outreach assessment. And there is also a hotline by the hospital authority, which is called the Mental Health Direct. We can actually search the contact online, and then they could assess the situation and see whether they could send someone, the community staff, to have a visit. But if that is not the case, if they're not really kind of homebound and they're still willing to come back to the school, and you have a chance to talk with them, it's actually the previous contents. We try to see what is, the most distressing, because for social withdrawal there are several possibilities. Perhaps they may not be necessarily ill. They may just feel that they do not mix with the group, so they don't come back, or they may be suffering from depression, so they lost the interest to talk with others, or they may be having features of psychosis. They feel that the people are trying to harm them, so they, bound themselves at home. But anyway, so it depends whether the situation, and then we'll see whether we do it ourselves and then we seek help from others.
Marvelous. Thank you, Dr. Yip, for your invaluable sharing. Thank you. This session has now come to an end. Now let's have a 10-minute break. The next section will start at 11:45. In the next section, we have a choice of 3 concurrent sections. These include workshop, mindfulness, and self-care workshop. 和學生一起收集靜觀工作坊 on our live broadcast in Cantonese, or paper presentation 1 at Zoom in English, or paper presentation 2 also at Zoom in English. You are welcome to join this section according to your preference and interest. Thank you so much, and look forward to seeing you in the sessions later.